Welcome to today's video. In this video, we will address the misinformation that's floating around the internet that vaccines cause SIDS in infants. In today's media, there's a lot of misinformation surrounding vaccines, and one of them being that they cause SIDS in infants. And in today's video, we will be breaking it down. So, what is SIDS? Sudden infant death syndrome, also known as SIDS, is the sudden and unexplained death of an infant, usually during sleep. But how did the misinformation that vaccines cause SIDS occur? In the early 1990s, when a new vaccine, the hepatitis B vaccine, was recommended for babies. Around the time of the recommendation, the ABC News program 2020 aired a story claiming that the vaccine caused SIDS. The reporter told the story of a 1-month-old girl who had died of SIDS 16 hours after receiving her second dose of the hepatitis B vaccine. At the time the story aired, about 5,000 children died of SIDS annually. Within 10 years of the introduction of the hepatitis B vaccine, about 90% of infants were immunized, and the incidence of SIDS decreased to about 1,600 cases a year. In other words, as the number of babies immunized against hepatitis B increased dramatically, the number of babies dying from SIDS decreased dramatically. However, despite this correlation, the cause of the decrease in the incidence of SIDS wasn't related to the increase in hepatitis B vaccination at all. Rather, it was discovered that infants who died of SIDS were more likely to have slept face down. In response, the American Academy of Pediatrics introduced the Back to Sleep program, which dramatically reduced the number of SIDS deaths. Neither the pertussis vaccine nor the hepatitis B vaccine causes SIDS. So, why are vaccines important and what are the roles of vaccines? Vaccines are important because they train your body's immune system to recognize and fight off specific diseases, which provide protection against serious illnesses and prevent the spread of infections. Vaccines are important to prevent disease, and also protect communities by reducing the spread of disease, offer lifelong immunity, and eradicating diseases/illnesses. Before they're licensed, vaccines are tested in tens of thousands of children. These studies are large enough to determine whether vaccines cause common or uncommon side effects, but they are not large enough to determine whether a vaccine may cause a very rare side effect. Although there's a lot of scientific data that disproves that vaccines cause SIDS, parents should do their own research and also remember to always practice safe habits to prevent SIDS.